One, welcome all of you. I'm Daniele Zanotti, CEO at your United Way Greater Toronto, with some IT and tech friends in the background who have my back and who have muted all of you and your pets and your partners too. With Adriana, who will be moderating questions that you can send. Please do send to webinar@uwgt.org. I've been waiting for you for this time together, 1 hour, I know, but a show and tell and thank you of what you make possible on the ground in your neighborhood every day. In these days where this day, that day, someday have all squished and blurred, where we jump from Zoom to Team to WebEx to WhatsApp. And I gotta tell you, I don't know what's up, literally and figuratively. I just seek, as maybe you do, I seek simple moments of hope. Take, for example, my daily walk to the Humber River in Woodbridge in my neighborhood, where Clarence crosses the Humber River. And I'm grateful that centuries ago, the Haudenosaunee, the Huron-Wendat farmed vegetables, fished, hunted small game on this land where I stand, and I feel hope. And weeks ago, as I walked back from the Humber River, right at the corner of Woodbridge Avenue and Islington, there's a gentleman with a mask and gloves pulling grocery bags from his trunk. And he's putting them in 2 bundles on the sidewalk under this 5-story apartment. He whistles up and a couple in their 80s ventures out onto the balcony and waves down at him, smiling. Then on the balcony below, a chap with a cap and a cane waves and smiles down too. And together, the couple all of a sudden lowers this massive rope with this bag on it all the way down the balconies, right to the floor. The gentleman with the mask starts putting the grocery bags in, and they start heaving up these big bags of grocery, first to the 5th floor, and then when they're done, to the floor below. And they wave, send air kisses, and the gentleman with the mask and the gloves says, "Buon appetito." I yell across at the guy, "Hey, thanks." That gives me hope. And he says, "I volunteer to help a bit." So I ask, "Who do you volunteer with?" And he mentions, "Oh, this seniors organization's chats. You've probably never heard of them." He enters his car and he signals in typical Italian fashion, which is Italian for no food, no survive, kinda. Food. Today and every COVID day, it is the #1 issue that we hear from frontline agencies and groups at the community tables that we co-chair with the City of Toronto in neighborhoods across the 416. It's the #1 issue emerging in our coordinated partnerships in the 905 with the region of Peel and with the region of York. It is the #1 reason why people are calling United Way founded and funded 211. In fact, between April 1st and 8th, 211 referred over 2,700 callers to local food banks 1 week, at a time when an estimated 40% of the food banks in the GTA have closed as a result of COVID. Food. And thanks to you and your gift to United Way, and this network of 270 agencies that we fund across Peel, Toronto, and York, we continue to connect collaborate, and coordinate solutions in your neighborhood. And thanks to you, United Way was first out of the gate to provide flexible funding for our agencies so they could respond to the urgencies of COVID and food. Flexible funding, for example, so Caledon Community Services could pivot from their seniors congregate meal programs to overnight, mobilizing hundreds of volunteers and prepping and distributing over 500 food hampers to isolated seniors. And thanks to you, more than half of the over 70 rapid response and emergency projects we have funded to date, reviewing, approving, dispersing money within 48 hours, more than half of those emergency projects are solving for food. We've got a 24-hour hotline and hamper program with the Red Cross. We've invested in Anishinaabe Health, Yellow Brick House in York Region, Eden Food for Change in Peel. For this next hour, we're going to talk about food, and feel free to eat food if you wish behind the scenes as well. To bring you into the work you make possible every day. And we're going to chat with Kate Gravett, the Executive Director of York Region Food Network, Adoma Patterson, Manager of Poverty Reduction Initiatives and Community Engagement for the region of Peel, and Paul M. Taylor, Executive Director of FoodShare. Each of them is going to provide you with a behind-the-scenes look at what's happening on the ground, solving for food. And don't forget, send your questions through the chat box to webinar@uwgt.org. We're ready. And then at 3:30-ish, we are going to open for your questions that Adriana will have sent over to me. So let's begin in my home region, way up in York, with Kate. Kate, maybe you can walk us through some of the food issues that you are seeing in York Region. Start with what York Region Food Network is doing and where you're providing support.
Absolutely. So York Region Food Network, at the moment, we've shifted all of our resources towards food access. We've experienced a dramatic increase in inquiries via phone, via emails, and demand for food and need for food throughout the region. And this is coming from people of all different backgrounds, from every single corner of the region, from urban, Vaughan and Markham, all the way up to Georgina. And there is a mix of services that are available in each community, which is what's posing trouble and difficulties from our side as well. So what York Region Food Network is doing is we have a variety of interventions supporting access to immediate food right now. Every Tuesday, we're offering a takeaway breakfast. So it's a hot meal that we've created a kind of a drive-through system where people can come pick up a tasty meal for themselves and their families to take home. We've expanded our production kitchen program. So this program has been running for quite a few years, and we've partnered with Canadian Mental Health Association and their Housing First program on it. Normally, we have a team of about 20 volunteers who come together, prep meals, which then we share through CMHA and that Housing First program. In response to COVID, that is now a skeleton staff of 2, sometimes 3 if we're lucky, who are prepping over 200 meals each week, which we're now distributing through the Housing First program, through Hope House Community Hospice, and also to a York housing complex in Vaughan as well. So trying to get food more easily into the homes of folks who are 70 plus, folks who are experiencing various illnesses and really just can't leave their houses right now. The other major element to our services right now is our Good Food Box. With our Good Food Box, we partner with fresh produce suppliers and farmers in Markham, and we purchase fruits and veggies at bulk at wholesale prices, and we're able to pass those wholesale prices along to our customers. So essentially, everyone is getting a giant banana box full of fruits and veggies at a price that is affordable, and it gives everyone the opportunity to purchase as well. So luckily we're now able to subsidize some of those boxes, offering either more produce per box and also making it more flexible for people who just who need boxes of fruits and veggies. And lastly, one of the most important things to us as an organization is really that value. We really value choice. We believe that people should have the power to go to grocery stores and have access to land, be able to grow, purchase, and obtain food in ways that are culturally, ecologically, and nutritionally appropriate for them. So what we are doing is year-round, we offer grocery cards to anyone in the community who needs some support with food. And what we've done is we're in the process of increasing the amount that we're offering for grocery cards and making sure that we have more grocery cards available to folks in our communities. And this is one way that it makes it just slightly easier for us to try to reach some of those corners of the region, which aren't necessarily, don't necessarily have the resources or the flexibility and the opportunities to connect people with food all the time.
Corners of the region, indeed. When you think about it, Kate, and you think about York Region, urban, suburban, and rural, you've been part of this table that United Way is bringing together with the region of York that includes a number of stakeholders. Maybe you could tell us a little bit about that work at the table and what you're seeing as hopeful in the people that are coming together and the solutions that you're able to create as a result.
I must say we have felt so grateful for that table. It's we're an agency, a very small staff of 10. At the time of that March 16th, when everything changed in our worlds, we had three of our staff were in self-isolation. We were down to a team of 7, just trying to manage and to try to cope overnight. And for us, we were very much just kind of looking at the ground, trying to adapt to working from home, adapt our services. And while doing that, knowing that we were getting, I would say, hundreds and hundreds of emails every day of people inquiring about food services. The phone just would not stop ringing with people trying to figure out how they can have deliveries at home and not having the financial means to purchase food and trying to figure out what their options were. So for us, just trying to really respond within our community and to residents and members throughout York Region, it has been amazing for United Way and in the region of York to create this food access cluster. And it's an opportunity for us and some of the other food agencies within York to come together on a weekly basis and to allow us to communicate what's happening, who we're serving, where the gaps are, and to make sure that it's a comprehensive approach to ensuring that everyone in our community is able to access food right now during this crisis. So at that table, we're seeing so York Region Food Network, some of the emergency food agencies within the region, both from an urban perspective and a rural perspective. We're seeing both school boards sitting at that table and offering perspectives around student nutrition programs. And we're seeing a lot of people who are working in community investment and within government who are able to understand what resources we have, what resources might be available, and to kind of connect us accordingly with volunteers, with if it's food donations, and anything we might need in order to streamline our services and really maximize the impact.
We've had comparable tables like this in the past. What's your hope post-COVID that this partnership, this cluster approach will be able to provide and sustain maybe something we couldn't do in the past, both at a frontline and then at a systemic level, Kate?
I think there's real opportunity. One of the biggest challenges in the past has been that capacity in order to coordinate and really implement actions from a table like this. So over the years, groups have met. We've shared frustrations and service gaps and looked at opportunities to support one another. But it was everyone at the table was doing this very much at the side of their desk. So it was something that we all identified as necessary and needed to be a priority, but serving our participants serving our clients always ranked a little bit higher. And I would say as a sector, as the food sector within York Region, we don't have enough people in the past who have made this happen. So my hope for this table is really that this might be able to really foster more coordinated food access questions, food system policy developments in the future. I think with COVID, we're seeing really the weaknesses that are in our food system, and in every which way, from production and labor all the way to food access. And this table, although it's coming together around emergency food access and immediate food access, I really do see it as an opportunity to further that conversation, not just accepting food charity, not just glorifying food charity, but really questioning that and working towards solutions and opportunities that actually put more money into people's pockets and make it that people can actually go and purchase their own foods or grow foods in ways that are appropriate to them.
So helpful, Kate. Thank you. Thank you for that. And it leads me into the structural issues that we know are deeply embedded in the work we're doing in COVID. Yes, we're looking at emergency, but deep down, we're looking at issues of poverty. Deep down, we're looking at a lack of food and a lack of a food ecosystem. These are all issues that we've worked collaboratively in Peel with the region of Peel, and particularly with you, Adoma, in some of the work around the Peel Poverty Reduction Table that we've co-chaired for years together. And now the newly formed Peel Regional Community Response Table, with many United Way agencies sitting in that moment to collaborate not only on the emerging needs, but on the deeper systemic work. Maybe, Adoma, you can talk us through what you're seeing in Peel, what you're seeing at that table, and how they're grappling with emergency and system at the same time.
Thank you, Daniele. So, absolutely, like all other communities, Peel is in the midst of trying to figure things out as we go along. What is clear, particularly through the folks at the Peel Poverty Reduction Committee table, what's clear for them is that the urgency, COVID has just made the issues much more urgent. Our priorities were always around economic opportunities. So the types of jobs people have access to. And COVID is impacting that tremendously, particularly for folks who are in entry level and precarious work. They are most at risk. Income security. So what support and safety net is there during times of need? And again, we're seeing the safety net, and our system is being tested significantly right now, and who is falling through those cracks, what gaps exist, what segments of the population are still not able to access support. And the other theme really is around social inclusion and well-being. So we're far apart. We have to remain far apart. Who is supporting people as they are at home? When they do need that meal, it's often they need that meal plus other things. And so that idea of well-being and being, your neighbor's keeper, again, is being redefined through COVID. So for the Poverty Committee, the sense of now is so, so important. I read a story last week about payday loans, for example, and they're thriving because people need money. Mm-hmm. People's livelihoods are at risk. And so, what does that mean, right? These companies are now charging astronomical interest rates. And so people will continue to be in this cycle. So we see the ripple effect. Food is, as I mentioned, often the gateway because it's the most immediate thing. You have to have that meal and you need those groceries every day. But when our organizations and our partners are talking to people, then they're hearing about the isolation, the loneliness, the mental illness, the fact that people are worried. How long can they continue to rely on the food bank, food programs, the agencies before things become really dire? And the longer this goes on, that becomes more worrisome. So,
Maybe talk to us a bit about that, the longer this goes on. Like, if this emerges over time into the summer, what are some of the regional concerns over increasing challenges to accessing food and food distribution? And what are some ways you think United Way, the region, and our agencies could work collaboratively on that?
So I think, we all agree that this food is going to become even more of an issue, right? So this is going on into July. If this goes on into July and August, more people will need, whether it's the hamper or a meal program. So our agencies are under increasing pressure. And many, if you look at the organizations that are feeding folks in Brampton, for example, many of them are all volunteer-led, or they rely heavily on volunteers. And our faith community provides a significant amount of support, food, and many more have stepped up as a result. So I think there's the pressure on both ends. So people are going to continue to need access to food. But the folks who are providing the food, we think about things like burnout and the ability to sustain volunteers and to rely on volunteers for the duration. And so some of those themes have emerged through the Peel Hunger Relief Network, who actually was meeting earlier today, just talking about their ability to continue to mobilize people and to help people understand that the need for food isn't going to be over in 1 or 2 weeks. And that becomes more complicated the longer people aren't able to find work or to have to stay off work.
It sounds like with your comments, Adoma, with Kate earlier, we're scratching at some of the system issues that lie below COVID. Paul, you are not only the executive director, of course, of FoodShare, but a real champion on social justice. You continue to advocate that access to food not only is a basic human right for everyone, but that COVID is in some ways making the invisible visible. Talk to us a bit about what you're doing at FoodShare to ensure people have access to food, which is a human right.
Thank you so much, Daniele. And I think that's actually where we start with our work. My colleagues and I recognize that there needs to be much more of a public conversation about the fact that in this country we have a right to food and have had one since 1976. It's actually enshrined in the international human rights documents, in particular our economic and cultural and social rights. So one of the things we recognize is as we try and animate more of a public conversation about the right to food, we recognize that we need to explain to folks what it is and what it isn't. So the right to food, we're often explaining to folks, is that it doesn't mean giving out free food. It actually means that our governments have a legal, and I would even argue a moral responsibility to create the conditions that allow people to access the food that they need. The biggest challenge is we've got this kind of recipe for hunger and poverty. We have low minimum wages, leads to poverty. We have high housing costs, and then we also have we've made food a commodity. So despite the fact that folks have a right to food, it's a commodity. So that recipe leads to over 4 million people in this country being food insecure. So we recognize that we need interventions like affordable childcare, housing, affordable housing, and income that support the right to food. So across this country, when we have that many people that are hungry, organizations and groups of people like FoodShare, we respond to this moral imperative. We've got people that are food insecure, and we really want to do what we can to help them. So I think for over 35 years, FoodShare has really focused on supporting access to fresh food, fresh produce in particular for folks. So some of the ways that that's kind of evolved over the years is one of the things, I'll list a few things that we do. One is we support over 50 affordable produce markets across the city of Toronto, what we call good food markets. So they're very much like farmers markets, except what we prioritize is affordability over local, although there's often quite a bit of local produce. We also are involved in supporting the development of student nutrition programs in Toronto schools. So through that, we're supporting over 100,000 kids to access a meal in their schools every day. We also have a bulk produce program where we sell bulk produce mainly to community organizations to help them. You know, we leverage the fact that we're able to buy in such bulk and utilize that capacity to offer low prices. We also, like the York Region Food Network, we also have a good food box where folks can jump online and for as low as $16 have a good food box delivered to their home. And then our programming also involves quite a bit of community-based farming. So that's, you know, a bit of a nutshell in terms of what some of our work looks like.
How has it changed with COVID? Who are you partnering with now at FoodShare differently to reach out to those isolated groups, Paul?
Yeah, so we've partnered with, first we've made a huge shift in the way that we do our work, you know, transitioning, of course, a lot of our colleagues to their homes, but we recognize that through the Good Food Box, we can help even more people. So we've been securing some financial support to be able to provide free good food boxes to folks in need through partnership. And I'll talk a little bit more about those in a second. So we get regular orders through there, but we also recognize that the Good Food Box, because it's delivered to someone's home, is a really neat intervention that could potentially support a lot of folks in the context of a pandemic. So what we did is we made an internal designation of essential services staff within the organization. So those are the staff that had already been working on the Good Food Box initiative. We started with reminding people of their right to refuse unsafe work. We gave a $4 an hour increase to the folks that were doing this work that we deemed essential, and reminded folks about some of the other things that are, some of the other supports available to them. So we went from about 200 orders a week to closer to 5,000 a week. So it was a huge scaling up, redeployment of staff, new partnerships. So we've been able to partner with groups like, there's over 40 of them, but we've been able, a few that come to mind, the Workers Action Center, so we've been able to get food to undocumented workers, the Migrant Resource Center, Maggie's Toronto, so we've been able to support survival sex workers, Black Lives Matter, Native Canadian Center of Toronto, African Food Basket, and also the Toronto Restaurant Workers Relief Fund, and of course our friends at Black Creek Community Farm supporting the Jane and Finch community. So, and one other thing we've just introduced is we're also trying to look at how we can provide support to drop-ins across the city that are supporting homeless folks. So we're offering free produce to the 59 homeless drop-ins across the city through the Toronto Drop-In Network.
Before we open it up for some questions, Paul, and for everyone in the on the webinar, remember, send your questions to webinars with an S, sorry, webinars@uwgt.org, webinars@uwgt.org. Paul, I referenced an article you wrote for the Toronto Star and the Metroland papers, where you talk about the pandemic will end, but some of the structural inequalities will not unless ... What are some practical things that we in our sector could be doing to help address the frontline and then some of these systemic issues and inequities?
Absolutely. So one of the things that we often remind people is the very same communities that were affected by food insecurity before COVID are struggling even more so. So we're talking about racialized communities that are already overrepresented in food insecurity stats. We recently partnered with Proof out of the University of Toronto, and through analysis of the Canadian Community Health Survey, recognized that if you're Black in this country, you're 3.5 times more likely to live in a food insecure household than if you're white. Almost 37% of Black children in Canada live in food insecure households. So those things clearly speak to structural racism. We see Indigenous folks overly represented in food insecurity stats. So that's, you connected to the legacy of colonization and continued colonialism. So those things haven't changed as a result of COVID-19. So one of the things we've been really involved in pushing for is the collection of race-based and socioeconomic data so that we can have a health equity approach. We know that access to healthcare and healthcare supports is not equal. So we need to be pushing for, I think, an equity-based approach to everything that we do. And then also when it comes to food, we know that I talked about if you're Black, you're more likely to be living in a food insecure household. We need to challenge systemic racism. We need to challenge white supremacy and some of those organizing principles that really affect who gets to eat and who doesn't.
We've heard a lot about in the US, and we're beginning to hear this in discussions in Canada about the impact of COVID on low-income neighborhoods, on racialized groups, and the need to collect data by postal code and by culture, gender, and race. And I think we've heard in each of your comments, not only practical things that we could do, but also broader systemic things we will have to turn our eyes to. We're starting to get some questions texted over to me from Adriana. One of them that came through, and I think we touched on this, Adoma, in your response around longer term access to food and food distribution. And the question is, will you address food shortage due to the food destined for business that is being discarded, as is the case now in the US? Is anyone looking into whether organizations like the United Way and food banks can access these food surpluses? Maybe we'll start, Adoma, has the region thought about that? And then we'll ask each of you to think about that.
It's the issue of food has come up through the community response table, which is the table that has been meeting 90 plus stakeholders. And so early on, many restaurants, for example, had surplus food and started to reach out and offer their support, not just with the food, but in other ways, helping with delivery or even cooking and preparing meals. Lots of chefs, for example, were unemployed, became unemployed, and have offered their services to a number of agencies. I think, I agree that there's a broader discussion, which we have been having prior to COVID, which is just now magnified, talking about the food system and who controls the food system. How does food get distributed and shared? And I totally agree, and the Poverty Committee has always said that food is a human right. And so is this an opportunity now for us to think differently about how that food is shared? The school boards, for example, also had food in their buildings once they closed. And so again, it's, through the community response table, we have been looking at sort of that broader food and the access and how to redistribute that.
Kate, any comments on how York Region Food Network or how the partnership and the cluster table in York is looking at access to some of these food surpluses?
Well, in the early days, we had quite a few restaurants reach out to us with fresh produce, looking to find homes for that. So we were one of the, I want to say one of the few organizations who was able to take that, repurpose it into prepared meals, which we could then distribute. In terms of masses of surplus food, one of the organizations who also sits on that food access cluster is the Food Bank of York Region, and they have very much a second harvest model. So taking surplus food, reclaimed food, and redistributing it to social service agencies, food banks, and folks throughout the region. So from that table, there is an increase in information of understanding what foods are available, what could be useful to folks as well, and to agencies. From York Region Food Network's perspective, I must admit we are at a food bank, so we are always very careful about food donations. We prioritize fresh food donations versus some of the larger, more processed food donations as well, which might be high in sodium, high in sugar. So I think that for us, when we look at food donations, it is making sure that although we are trying to get food donations and food out to people throughout the area, the region, who might not have anything to eat right now, we're very conscious that we want to make sure that health is at that forefront of conversation, and we aren't just giving out food to give out. We're giving out food that is what people want and that has nutritional value.
Mm-hmm. Paul?
Sure. I'm going to, the first thing I'm going to say is we shouldn't be wasting as much food as we are in this country. Absolutely. I think the problem, the reason we do that is complex, and we need to be having that conversation. I think my concern is that when we combine this conversation around surplus food with food insecurity, that's ultimately about poverty, we do a very dangerous thing. You know, we reinforce this idea that food is a solution to those things, but food doesn't take care of children. Food can't live inside food. And, you know, I certainly don't put food in when I'm taking transit. So I think we've got to focus on those pieces. And I'm of the opinion that nonprofits actually shouldn't be the ones who are tasked with dealing with the waste that's produced as a result of the commodification of food. We can't buy one cucumber anymore, or at least when we do, it's wrapped and it's got a sticker on it, you know, or there are three of them together. So I think, and those sorts of things cause food waste. So I think it's a complex question. Yes, we need to waste less food. I don't believe that it's the answer to poverty, challenging poverty.
We've got another question that's come in. Are there any practices around food security that have emerged that you believe may be here to stay? Anyone?
I'm worried that we're about to put justice on a ventilator, you know, and kind of an equity approach to how we support folks. Because if we kind of reinforce this conversation that, like I say, food will solve these underlying and systemic issues, we run the risk of, like I say, putting justice on a ventilator. And I think we need to be really focused on what's the world gonna look like, what's our city gonna look like after COVID-19, and how do we really address the structural issues that we're dealing with.
Adoma, Kate, you want to add on to this line, this drop the mic line of we're putting justice on a ventilator?
Well, you know, I agree. COVID just magnifies what was already there. And in some cases, it will make it worse. The income inequality, who is being left behind. In Peel, we also have the conversation around the need to collect disaggregated data, to think about how funding decisions are being made, what lens is being applied. Women are being disproportionately impacted by COVID, racialized, so Black, South Asian, and other racialized communities in Peel. And so now that we had that initial shock of COVID, right? So the first couple of weeks we were in shock and just reacting, and we reacted well. You know, people came on board. Community residents, they wanted to help. We're now at a stage where I think we have to start asking some of those critical questions, and because we still have enough time to reflect and to put some of the solutions in place. I think that will make sure that folks aren't being left behind further, or that we're not doing more damage once we come out of this.
There's so much talk, Adoma, you use the word like the response, right? There's been so much talk about the traditional phases of response, you know, and then hopefully recover and rebuild. But everything about COVID is so different and new that even those three structural phases now we as a sector are going to have to look at differently. Kate, maybe over to you on, is there anything you're seeing around food security practices or just generally in the in the ecosystem that you think may be here to stay?
Well, on the positive side, and this actually takes us out of the low income demographic that we're speaking highly of, but we are seeing some interesting food skill developments happening. So we are seeing as a huge surge in folks who are trying to acquire seeds to grow food. We're seeing a huge surge in people making bread, in people meal planning as well, which has been very, very interesting, because I know in some of our classes, especially tying together food and climate change and environmental waste and food waste, meal planning is a hard thing to teach, and people going out once or twice or twice a month are really trying to maximize that. So I think on the positive, those are some interesting food skills and food strategies that we are seeing that I hope will be here to stay, because at a household level, we are wasting tons of food, and there are opportunities to change that for the benefit of the planet. But my biggest worry, and we have a almost daily conversation amongst the staff about it, is the idea of food charity. And if we are glorifying food charity, if we are perpetuating this idea that immediate food access is the solution to the problem, it exactly is that to us is a huge disservice. Food insecurity, it is an income issue. The solution is income based. That we do know there's a lot of failures and weaknesses within the food system, and systemic racism perpetuates so much as well. And even when we see who is working in the food sector, it is it's definitely not represented in any which way. So for us, we're hopeful. We are going to continue our messaging and advocacy around not looking at food charity, immediate food, and emergency food as the response and the solution. Our worry is it will continue to be further institutionalized, just like food banks happened for the past 40 years. So we're doing a lot of work in our messaging, social media, in our newsletters, and everyone that we're speaking to make sure that we're pairing the immediate short-term response with this bigger conversation around systems change.
Let's hold on to hope. Let's hold on to that word that you've said a few times, Kate. Thank you, hope. And maybe each of you could think about something that is happening locally in this moment that you hope we can pull forward, we can scale in a new food ecosystem. Something hopeful that you're seeing, that you hope we can continue on with. Paul.
It's a good question. I guess the first thing that comes to my mind is what I'm feeling is that collectively we're starting to challenge low expectations around what's possible.
Agree.
So that to me is super exciting. Hopeful, we're seeing governments dole out lots of money and focus in on this issue. So we're starting to kind of think about more being possible. But I also, I want to just give one shout out as well. There's something else that's giving me some hope is a shout out to the folks at the Daily Bread Food Bank and North York Harvest and the like. It's great to see food banks in this fight trying to resuscitate justice as best they can, because that hasn't always been the case. So I think that's something that I'm seeing more and more, and I'm excited to see where that goes and how we can work together along that.
Thank you. Adoma.
So I'm hopeful that the new ways and different ways and additional ways that we work together across the sector, so government, the charitable sector, nonprofits, even faith, that some of those things, that legacy will last. So, prior to COVID, we sort of did our thing in silos. We came together on specific issues. But we see in terms of the response that it is possible for us to kind of put aside all of those boundaries and barriers that we created, even all of the rules that we created around who's getting access to fund what, to deliver what, and that, there are opportunities there, and that we think about people and service from the person's perspective, and not from our own individual organization's perspective. So I'm hopeful that, you know, there's some legacy there, and I look forward to us distilling and thinking about ways to make sure we're embedding those things in decision making and policy long after COVID.
Is there, I'm gonna push a bit, is there a promising, practical solution in Peel that you're excited about, that you're seeing coming out locally, outside of some of the sector collaboration that you eloquently spoke of?
Mm-hmm. I think there's broader engagement by residents in the conversation and the solutions. Because many are looking for their place in, you know, whether it's advocating around issues, access, or they just want to help. That the resident voice, people realize that they do have a voice. And sometimes, you know, in the 905 and suburbs, right, that voice isn't as loud as in places like Toronto or Hamilton. And so how do we mobilize as local government, as funders, and as nonprofit organizations continue to capitalize and value that voice that is speaking out, that may say things that we haven't heard before or we haven't been open to hearing. So what are the avenues that we can create, you know, even through things like the Peel Poverty Reduction Strategy, folks who are experiencing things on the ground now, how are we making sure that they're incorporated and that their ideas and their things that they're challenging us about are part of the decision making. So I you know, in Brampton, Caledon, and Mississauga, having that resident voice and highlighting that and making sure that that's been a part of the conversation has been a very practical and positive thing.
And we see it. I mean, as we, in our partnership with the region of Peel and the Peel Poverty Reduction, the voice of those with lived experience being at the table, being at the center of the table is critical. We've also seen it in the initial influx of people who wanted to volunteer for COVID. And it was, you know, can I give food? Can I volunteer at the food bank? And now we're beginning to see, how can I raise my voice with political leaders? How can I get involved in solving issues much more broadly? I mean, recently we funded an initiative, the Friendly Neighbors Initiative, where a group of about 1,000 volunteers have mobilized to provide food hampers to over 200 seniors living in Toronto community housing. And so I think there's an urge for people to do not only the immediate, but now to start thinking, where's my voice in this and how do I engage differently? Kate, you started with hope. You continued in all of your comments to give us hope. End us off, my friend, with something in York region that you're seeing practically, that you think, if we could sustain this program, this initiative, this thinking, this will help in the long work post-COVID.
So I've been working in food system issues in York region for about 8 or 9 years now. And this is the first time where food is on municipal agendas, all 9 municipal agendas, or agendas for all 9 municipalities and the region's agenda. And we have spent years trying to get food on these agendas. So for us, for our elected officials, for our municipal staff in each of the 9 municipalities and at the regional perspective, for all of the agencies that we work with and community partners, for everyone to have food at the top of their list right now, to us, this is, it's very hopeful. It means that we can actually have these conversations around food systems, around who has access, who doesn't, how do we distribute food, where does the surplus food go, how do we make sure that we are creating systems that are equitable and that really do speak to what people want to be eating, and making sure that they have those culturally, ecologically appropriate foods. So to me, really, I'm hopeful, and what I'm hoping will last or will continue is that food stays on the radar of each of our 9 municipalities and at that regional level. And I think with the food access cluster as well, that's a huge step in helping us make that happen.
The final question I'm going to ask, it's just come in, is there one thing that you've learned organizationally through COVID that you will take with you to work differently? Organizationally. And you might say, no, this is how we've thought before. But if you really think through, is there anything different organizationally that you've learned through COVID that you will take with you as an organization? Adoma.
Yeah, so I was thinking about, again, through the community response table, and why that has been so valuable. And I think it's because, you know, as regional and local government, we don't often have the platform or forum to have this two-way dialogue with folks that we consider stakeholders, right? So the 90 organizations, the school boards, meeting 3 times a week to, you know, share collectively, individually and collectively, what are we seeing, and to problem solve together. So, you know, sometimes people will say, well, it's the government's responsibility. And yes, absolutely, some things are the government's responsibility. But so I think having this mechanism, creating a mechanism as we leave COVID to be able to really hear from people, them speak honestly, them challenge us around, you know, decision making, their voice being central to how we're doing the work and how we're supporting people. You know, I think has been fantastic and should be one legacy.
We call it a united way. Paul, anything you've learned?
Yeah, I guess, you know, that anything can change at any moment. And, you know, in a lot of ways, this is such a resilient sector, you know, so I think it's not that I've just learned that, but it's certainly reinforced that for me, that we can come together in new ways, we can tackle issues in new ways and have difficult conversations. So that is something that I really continue to be inspired by.
Thank you. Kate, last word. We started with you, we end with you.
I would say organizationally, there's 2 things that pop to mind. Really, it is that flexibility. It's the not assuming anything, knowing that at a second's notice, everything will change, and just being okay with that. And then the other big element to us is that communication focus. Again, we ourselves are a very small organization, and we're trying to communicate messages out to the entire region of 1.1 million. So for us, it's always been a challenge of how do we reach people, and I think one of the legacies that I am hoping that we'll be able to continue is the strength of communication, and that's through some of our partner organizations. That's through the strength of United Way and the region of York, and also through York Region Media Group, who have really been champions in helping us get out some of the messages, and also some of the information to folks throughout the region.
Kate, Adoma, Paul, thank you for your work every day. And thank you all donors, volunteers, agencies for being with us yesterday, today, and tomorrow. Because as important as all of this emergency rapid response is, and it is now, today, we know this emergency response funding, the over $1 million that United Way Greater Toronto has invested, for example, thanks to donors like you, above and beyond any government money, that $1 million that we have invested into rapid responses for COVID is so critical today, but we also know we must ensure this network of agencies is here, connected, collaborated, coordinated for tomorrow as well. And thanks to you, United Way invests over $6 million a month in programs across Peel, Toronto, and York. $6 million a month, so that these supports, these solutions that you've heard about are not only there in times of crisis, but will be there when we emerge and rebuild for years to come. These frontline agencies with so many frontline heroes, staff and volunteers, people who behind the cameras and behind the headlines are helping to distribute food to the homeless, food to isolated seniors in your neighborhood, in my neighborhood. Frontline heroes that we've been championing on our social media, and please take a look at it, from United Way funded agencies like Bernard Battelle Center or Our Place Peel, from the Distress Center to the neighborhood group, these frontline heroes. And here's a note that landed in my inbox, and I quote, "I just wanted to thank you, United Way, from the bottom of my heart for extending funding for travel to frontline workers like me. You know my story. My husband, the love of my life, in and out of jail. My son attempted suicide, heartbroken about not seeing his dad. No money, then no food, then finally homeless in a shelter. And United Way was there at a time when I needed love more than I needed air. United Way was there. Now my hubby is home and well and contributing to society. My son is happy and in love," he says, teenage love. "We live in Oshawa, and I travel by transit over 3 hours to and from work every day at a United Way funded agency. If you can call it work, I call it my mission. I feed the homeless. I help men like my hubby heal. I'm a type 1 diabetic and immunocompromised. I've been paying for Lyft out of my pocket. Then I got an email last week from my executive director that United Way is covering the cost. Some partnership United Way has with Lyft. Now again, United Way is here at a time when an invisible frontline worker like me needed just a sign. I felt this burst of hope to keep on. Thank you, United Way. Thank you, friends. Take care of yourself so we can take care of each other at a time when community matters now more than ever. We'll see you at the next webinar for another update on the work, on the hope that you make possible. Cheers. Have a great one.